What is a heart attack? We are going to explain it to you, but the most important thing to understand is that a heart attack is a medical emergency. A heart attack happens when there is a loss of blood supply to part of the heart muscle. It often happens when there is a blockage in a nearby artery that supplies blood to the heart. If blood flow is not restored quickly, part of the heart will begin to die. A person who is experiencing a heart attack will feel pain in their chest and other parts of their body, along with other symptoms. Our goal is to help you recognize the early signs of a heart attack so that victims can get prompt treatment, which is crucial for saving a person's life. A heart attack is different from cardiac arrest, which is when the heart stops working completely. Both are medical emergencies, because without treatment, a heart attack can lead to cardiac arrest. In this video, we will look at how heart attacks happen and how to treat and prevent them. It is important to recognize the symptoms of a heart attack. As heart attacks can be fatal, it is crucial to recognize the warnings as soon as possible and contact emergency services. The symptoms can vary from one person to the next. They will also vary in their order and duration. They may last several days or come and go suddenly. Symptoms include a feeling of pressure, tightness, pain, squeezing, or aching in the chest. Pain that spreads to the arms, neck, jaw, or back. A feeling similar to heartburn or indigestion. Nausea and sometimes vomiting. Feeling clammy and sweaty. Shortness of breath. Being lightheaded or dizzy. Anxiety that can feel similar to a panic attack. Coughing or wheezing from fluid buildup in the lungs. Be aware that the signs of heart attack in a woman can be easily overlooked. Females and males sometimes experience heart attacks differently. Knowing the female-specific symptoms of a heart attack could help a person seek medical attention sooner, which may save their life. Statistics show that women are less likely to survive their first heart attack than men. It is common for women over age 40 to be feeling other things in addition to some chest pain or discomfort. She may even presume her symptoms to be the side effects of menopause. Many times a woman may attribute any of these symptoms to exhaustion or the flu. Often, neither the woman nor her doctors initially think it's a heart attack, even though chest pain is the main symptom. Signs of possible heart attack in women include nausea, indigestion, stomach pain or some acid reflux. Pain or discomfort in arms, neck, jaw, or back. Fatigue. Shortness of breath. Dizziness or fainting. Cold sweat and paleness. There are many conditions and factors that can bring on heart attack. The most common cause of a heart attack is a blockage in one of the arteries near the heart. This can result from coronary heart disease, in which plaque, made up of cholesterol and other substances, collects in the arteries, narrowing them. Over time, this can obstruct the flow of blood. Less common causes include the misuse of drugs such as methamphetamines or cocaine, or situations that cause low oxygen levels in the blood, like carbon monoxide poisoning or smoke inhalation. Treatment of heart attack can be extensive. A heart attack is life-threatening and needs emergency attention. It is possible to survive heart attacks if one receives emergency and follow-up treatment. However, delaying treatment dramatically reduces the chances of survival. If you believe that you or someone else is experiencing heart attack, call 911 immediately. Be ready to explain what has happened and where you are. Stay calm and follow all instructions from the emergency team. While waiting for first responders to arrive, talk to the person and reassure them that help is on the way. Medical treatment begins with emergency personnel. When the first responders arrive, they will take over the person's care. Give the team as much detail as possible about the person's health and what was happening before the event. They will try to stabilize the person's condition, then transport them to emergency care. Once the heart attack victim is at the hospital, a medical team will perform tests and provide appropriate treatment. There are many approaches to treatment after heart attack, but 3 common options are medication, restoring blood flow to any damaged tissue, or heart bypass surgery, which diverts blood around damaged areas of the arteries to improve blood flow to the heart muscle. The healthcare team will also develop a prevention plan that is designed to prevent future attacks. Some people experience complications after a heart attack. These may include depression, which is common after a heart attack, and it is not to be ignored. Heart attack victims need positive engagement with loved ones, and often join support groups as well. Arrhythmia. Periodic episodes when the heart beats irregularly, too fast, or too slowly. Such events should be reported to medical professionals in charge of the person's care. Heart failure occurs when the heart muscle doesn't pump blood as well as it should. This causes fluid to build up in the lungs and in the legs. The fluid buildup can cause shortness of breath. Poor blood flow may cause the skin to appear blue. Aneurysm is when scar tissue builds up on the damaged heart wall, thinning and stretching the heart muscle. This can also lead to blood clots. Angina, when an insufficient amount of oxygen reaches the heart, causing chest pain. Therefore, your cardiac doctor will recommend ongoing treatment and monitoring in order to help reduce risk of future complications. There are various ways to lower the risk of a heart attack. The American Heart Association advises people to make heart health a priority. Ways to do this include: 1. Avoiding or quitting smoking. 2. Following a heart-healthy diet. 3. Regular exercise. 4. Management of diabetes, cholesterol levels, blood pressure, and other conditions. 5. Limiting alcohol intake. 6. Maintaining a healthy body weight. 7. Avoiding stress or practicing ways to reduce it. Heart attack victims should understand that recovering will take time. Some people will need to make lifestyle changes before resuming regular physical activity, but many people will need cardiac rehabilitation. This is when the healthcare team will help the person come up with a specific plan to restore their health and prevent another heart attack. Depending on the severity of the heart attack and other factors, such as the person's age and overall health, each recovery period can be vastly different. Returning to work and other daily activities will depend on the person's job and the severity of the heart attack. As far as driving, a doctor will advise about the timing, which again, varies from person to person. Most people can resume sexual activity after 4 to 6 weeks. Erectile dysfunction can become a side effect of certain medications, but treatment can help resolve this. Remember, it is normal and common to experience depression during recovery from a heart attack, but counseling, support groups, and treatments can help. Who is most at risk for heart attack? You can improve or eliminate many of the risk factors to reduce your chances of having a heart attack. Heart attack risk factors include: men age 45 or older and women age 55 or older are more likely to have a heart attack than are younger men and women. Tobacco use or long-term exposure to secondhand smoke. People with chronic high blood pressure can damage arteries that lead to their heart. High blood cholesterol or triglyceride levels. Obesity is linked with high blood cholesterol levels, high triglyceride levels, high blood pressure, and diabetes. Losing just 10% of your body weight can lower this risk. People with diabetes are also at high risk for heart disease. Metabolic syndrome, which is a condition that occurs when someone is obese, has high blood pressure and high blood sugar. Metabolic syndrome makes you twice as likely to develop heart disease. Family history of heart attacks. If your siblings, parents, or grandparents have had early heart attacks, by age 55 for males and by age 65 for females, you might be at increased risk. Inactivity commonly contributes to high blood cholesterol levels and obesity. People who exercise regularly have better heart health, including lower blood pressure. Stress. Some people respond to stress in ways that can increase their risk of a heart attack. Illicit drug use. Using stimulant drugs, such as cocaine or amphetamines, can trigger a spasm of your coronary arteries and cause a heart attack. A history of preeclampsia. This condition causes high blood pressure during pregnancy and increases the lifetime risk of heart disease. Autoimmune conditions such as rheumatoid arthritis or lupus can increase your risk of a heart attack. After age 40, you should get regular screenings to prevent heart attack. To monitor your heart health, your doctor will check a number of things including your weight and body mass index, blood pressure, blood cholesterol, and blood sugar levels on a regular basis. If you are seeing a doctor for the first time, they will also ask you about your family health history, your own medical history, and lifestyle habits, which affect your chances of developing heart disease. Many other tests are available to evaluate your heart's function and health if your doctor thinks you might have developed heart disease. We have enjoyed bringing you another video, and thank you for watching this to the end. The tips and suggestions mentioned in this video are for general information purposes only, and should not be construed as professional medical advice. If you are over 40 and have not been screened to determine your risk for heart attack, it's important to consult with your physician to ensure that you have a clear understanding of your personal situation from a medical or mental health standpoint. Is there a particular subject you would like to know more about with regard to issues surrounding a healthy lifestyle for people over 40? Leave us a comment and we'll be happy to put together a video. If you have learned something new or helpful, please subscribe to our channel.